And that lasted for about almost a month, and then he pulled me off it, and then he brought me on. Then he said I could have cooked vegetables, potatoes, beans, broccoli, carrots, that sort of thing.
That's all good stuff still.
And lettuce, salads.
Linda did the same thing.
Yeah. Salads, and I love salads, but I like my dressing on it. I couldn't have any dressing, so it was very plain again. But 2 weeks ago, he said, "Well, you could put fat-free ranch dressing on it." That was a treat and a half, if you want to believe it. That was delicious.
A good treat.
Yeah, and
it's tough, but
it is. It is. But the long and the short of it is, through the whole process, my GP, who first discovered there was a problem, has been very helpful and very cooperative in getting the blood work done. He does it in his own office with his nurse. And he's a fine man of God, and so is his nurse, and they're very sympathetic with my problem. And he gets excited every time he sees the results, because he saw what was before and he sees what's now, and he says, "It's working." And he said, "You just keep on doing what you have to do." He
see,
said, that's amazing.
That's what they say.
Let me interrupt and here, Linda, something that it goes down your alley, and to the alley of anybody that want to hear this. It is commendable, the support that I receive from the allopathic MDs in Canada, as opposed to the support and the addition to the allopathics in America that don't want us to touch their patients.
Really? That's a shame. That's a shame.
His GP said, bottom line, working, continue doing it. Go on.
That's a shame.
So I'm sorry to interrupt.
That's okay. That's okay. And so he's been very helpful in getting this process and getting the information. Because Dr. Fried's only had my blood work to work on, which we had faxed to him, to monitor my condition and see where we go to next. Because this is the first time in 6 months I've seen him. And it's amazing he's been able to deal with me in such a great distance. And
well, but let's pass the credit over there, behind you.
Well,
that's my hands
No,
over there. My hands and my intention is made, you know. And it wasn't an easy thing, because you realize that this is a totally an electronic contact. You know, we use emails, we use letters, we use UPS, we use the telephone, we use any which way we could talk and exchange, you know, information relevant to the transmission from here to Canada to her, from her to her husband. I mean, that's a long hand, you know. And the therapy proved to be so harsh and so resilient that here's the result. You know, we beat that deadline. We are way out of the deadline. The same thing with you, my dear. And this is what I'm telling you, girl. Okay, you and I are going to talk in these terms in 90 days. In 90 days, we're going to talk these terms.
Yep,
Okay?
and in just, 5 weeks, I'm going to go do more testing, and I'm sure it's going to be great.
Yes.
Yeah.
The way I'm feeling, right, honey? I've been
Well,
feeling.
the fact that you're stabilized.
Yeah.
That's a positive look. I don't care how you look at it.
The way she feels is that I can no longer control
You
her.
could get that to start to decline.
What's that, doctor?
No, I'm saying that the way she feels is that Al can no longer control her. Control her.
No, he can't.
Oh dear.
Dr. Frida's knows.
well, I think the exciting thing about the blood work that I've got back is that my white blood cells are normal. They were right out of whack. And my platelets are normal, and they were right out of whack. My red blood cells are at 2.75, which they were almost down to below 1.
Out of whack means he had none.
Yeah, basically
Okay.
they were all bad ones. And,
Wow.
and as Dr. Pease pointed out, all my other blood tests related to the various things in my blood are all pretty much within the normal range. And they weren't before. I was, in my terms, I was polluted last October.
You were so bad with the blood test here that the chief person who checks the blood work at Auburn Hospital called us at home when we got home and said, if you were a walk-in at this hospital, do you realize how bad you are? And of course we did, but it frightened him to death that he called, and he had to get the number because he got a copy of your blood work. That was how serious it was.
Wow.
he's entering now in another aspect of the therapy also. Okay, he's going to go on monoatomic support, which is the monoatomic support, something that you are going to go in, and Linda was partially, because you see that the etiology of these conditions are different. Okay, this is an ovarian involvement, and this is a blood disorder. This is a pap disorder. So the therapies fluctuate and you know
Right.
and so forth. Nonetheless, Bioxyte is monatomic. Okay, that's what we say about passing the tissue completely before it even reaches your stomach. You know, I mean, it doesn't ever reach your stomach, because if it were to reach your stomach, Bioxyte will kill all the colonizing bacteria in your stomach and your digestive tract in one single dose.
Wow.
So that's the important component. Okay, and Bioxyte is dedicated to kill bacteria, virus, and fungus, any form of infectious agent, known or not known to man. I mean, this is not a light-threading little pathogenic involvement. This is a generalized.
Right.
Now,